Hey everyone, and welcome to another Tip Tuesday. Today's tip is a very interesting one, and it is how to deal with prejudice in the workplace. And it's one that's very relevant every day. Prejudice is the preconceived thought, notion, or feeling of how an individual may act or perform based on either the individual's own prior experiences or maybe something else that they were taught. Essentially, there's no reason to ever be prejudiced towards an individual, especially someone who you have not given the chance to get to know or actually see perform in the workplace. And it can be tough, because a lot of times these are just differences between individuals. I'm not talking about like differences in opinion, like, you like cheese versus they don't. This is differences in terms of your race, in terms of your gender, in terms of your sexuality, and even as an ING, we experience prejudice as well, or at least can. I think what we need to remember is that a lot of times these feelings of prejudice or these feelings to express some form of prejudice on another person kind of comes from lack of knowledge and experience with a lot of different individuals, or even it could come from one bad experience that's defined every single person for that individual in their future, which isn't fair. The most important thing, though, is to make sure that you maintain your well-being in all of this, and as physicians, maintain the well-being and safety of your patients. If at all this is ever compromised, you need to speak up. You need to report. You should always be able to speak up, though, by the way, just as a side note. There are different levels of communication in terms of how to resolve this interaction or unpleasant interaction with someone who is exercising prejudice in your work environment towards you or towards another individual. First thing, whether you are the person who is actually directly experiencing this prejudice or not, have a one-on-one conversation with that individual. Let them know what you see them doing, let them know how you're interpreting what they're doing, and let them know that's not right. Take the time to educate them too, sure. Oftentimes, and unfortunately, it's the moments which embarrass a person that encourages the person to change their behavior. If that one-on-one conversation does not work, if you've had multiple conversations with an individual and it has not worked, you go higher. You go to management. And if it still is not something that is resolved, and again, if at all and ever it compromises your well-being, your safety, your patient's well-being, and their safety, you report it. And I want to encourage you to do that and to take that step forward. It's a very, very hard step because you don't want to make enemies, but you also don't want to ever risk someone else's life because someone else can't act appropriately. So just keep that in mind when moving forward and trying to deal with prejudice in a diplomatic way. Another aspect of this, the lack of education and awareness from an individual, it's hard for me to answer that aspect for it because as medical professionals, we should already be aware of the disparities within society. We should already be aware of what individuals are experiencing in their everyday life. And even though there are statistics out there that show X person being more likely to end up with X like disease if they're exercising X behavior or they're of X socioeconomic status, you cannot assume that every single person's going to go there. You know it, it's a risk, you discuss it, but you treat everyone, patient, whoever, as their own individual case. They deserve that attention. And it makes me somewhat frustrated that even within the field of medicine, things like prejudice still exist. Whether it's patient to physician, physician to patient, and physician to physician. And we need to be cognizant of this. We need to be aware of this. So further from this tip, I would love to encourage all of you to really consider how you treat every single individual within your workplace. I'm not just talking about your fellow physicians, I'm also talking about how you deal with every single person within your work environment. That includes your nurses, that includes your administrative staff, that includes janitorial staff, that includes anyone, your volunteers that come on by, medical students who come in, whether they're local students or international students visiting. Be cognizant of how you treat every individual. Every person in the world deserves respect. Every person in the world deserves a chance to be able to show you who they are in terms of being the best individual out there on the field, being the most creative individual. They need to be able to show you that in a comfortable, safe space. You need to give them that opportunity too. If you put prejudice, and I'm not saying that you do, but if you or someone you know or someone who's higher up within the hierarchy of your department does put prejudice on an individual, guess what? They're not going to show you their best qualities. You're already starting with a fight. You're already starting with a very uncomfortable environment. And nobody wants to be in an uncomfortable environment. So really be cognizant of it. And take initiative to incorporate items of awareness, not just in terms of current events, or even in terms of just, months of awareness themes. For example, right now is Pride Month. Pride exists all year round. The same way Black History Month is 1 month, but Black history exists all year round. And you don't need to only reserve those dates of awareness to those months of the year. Celebrate it all year round. People are so beautiful. Their culture is beautiful. And you know what? Even their history is beautiful too. There are really upsetting things in everyone's ethnical history. But a lot of things that came out of it also created some beautiful minds, some beautiful contributions to our society as a whole. Educate yourself on it and educate each other and encourage everyone to be the modeled example that they want to see in the world. I hope that this tip can help you out with whatever challenges that you're dealing with regards to your work environment, and also any challenges that you're dealing with outside of the work environment. Prejudice has no place here at the foundation, and we do hope that this provides a safe space for everybody. With that, good luck studying.